A 24-year-old male is brought to the emergency department following a high-speed motor vehicle collision. He is hemodynamically stable, but complains of severe chest pain. I am showing you his initial axial contrast enhanced computed tomography scans. Describe the findings.
The axial contrast enhanced computed tomography scans reveal a large mediastinal hematoma. Directly at the level of the aortic isthmus, there is a focal contour deformity, a visible intimal flap projecting into the lumen, and an eccentric pseudoaneurysm.
State your primary diagnosis and the clinical grading of this vascular injury.
The primary diagnosis is acute traumatic thoracic aortic injury. Based on the presence of a pseudoaneurysm with an intact adventitial layer, this is classified as a grade 3 aortic transection.
What are the 4 clinical grades used to classify acute traumatic aortic injuries?
Grade 1 is an intimal tear. Grade 2 is an intramural hematoma. Grade 3 is a pseudoaneurysm. And Grade 4 is a free rupture with active contrast extravasation.
State the 3 most common anatomical sites of traumatic aortic injury in blunt chest trauma.
The 3 classic sites are the aortic root, the diaphragmatic hiatus, and the aortic isthmus.
Which of these sites is the most common in patients who survive to reach the hospital, and explain the mechanism?
The aortic isthmus is the most common site in hospital survivors, accounting for approximately 90% of cases. This is because the mobile aortic arch shears against the fixed descending aorta, which is tethered to the posterior chest wall at this junction by the ligamentum arteriosum.
Explain the clinical sensitivity and specificity of finding a mediastinal hematoma on a chest radiograph and computed tomography scan.
Mediastinal hematoma is highly sensitive for detecting aortic injury, but is not specific, as it can arise from non-vascular fractures or venous injuries. However, a hematoma localized to the periaortic region is highly specific for aortic injury.
List the indirect radiographic signs of a mediastinal hematoma on a conventional chest radiograph.
Signs include mediastinal widening greater than 8 centimeters, loss of the aortic knob outline, deviation of the trachea and nasogastric tube, depression of the left main bronchus, and an apical cap.
What direct computed tomography signs must you search for to confirm a diagnosis of aortic injury?
Direct signs include an intimal flap, contour deformity or pseudoaneurysm, intraluminal thrombus, pseudocorctation of the true lumen, or frank contrast extravasation.
Explain the immediate medical management required prior to definitive repair of a grade 3 aortic injury.
The immediate management is anti-impulse therapy using intravenous short-acting beta blockers, such as esmolol, to target a systolic blood pressure below 120 millimeters of mercury and a heart rate below 60 beats per minute, minimizing shear stress on the injured wall.
State the preferred definitive treatment for this patient and outline the critical safety warnings.
The critical safety warnings are complete aortic rupture leading to fatal exsanguination and spinal cord ischemia. Radiologists must immediately contact cardiothoracic surgery and interventional radiology for urgent thoracic endovascular aortic repair, or TEVAR, and recommend immediate initiation of intravenous anti-impulse therapy.